Hello everyone, I am Dr. Tanvi Mahant and welcome back to my channel HomeoHeals. So few days back I had a teenage girl who presented with eruptions on the face, and the father was like, because she is eating outside food, see what has happened to her face. Now this girl was suffering from Molluscum Contagiosum, which was a viral infection and not because of eating outside food. So today we are going to talk about this topic, that is Molluscum Contagiosum. We'll talk about what is it, how does it spread, and what can you do about it. So Molluscum Contagiosum is a viral infection caused by a pox virus and not because of eating outside. Though eating outside is not good, but that is not the cause of these eruptions. Talking about how does it spread. Now usually these eruptions are common in children, in young adults. It can also seen in all age groups, in older adults, okay, and in immunocompromised patients also. So usually in children, okay, when they play together in school, in the playing area, sharing personal items could be the reason to spread. The other mode of transmission of this virus in older adults could also be sexual transmission. So this virus can also be transmitted sexually. Now, how does it present? Usually it is a harmless infection in majority of patients. It presents with eruptions. Now these eruptions are slightly raised over the skin, present as pearly white eruptions, slightish pinkish, and we call it as umbilicated. It's a, you see a slight white tint sometimes over the eruptions. Usually present on face, trunk, extremities. In sexually transmitted cases, sometimes it can also be present on the private parts. Now in adults, it can also be spread apart from sexual transmission by sharing personal items or by person to person. Now usually apart from the presentation and cosmetic reasons, this infection does not cause any other symptoms. There is no itching over the eruptions. Sometimes because of dryness of the skin, there could be itching. And as I mentioned, in immunocompromised patient, that is people who have uncontrolled diabetes, who are on certain medications, who are suffering from HIV, the eruptions could be slightly severe. Now it can present as a solitary eruption, or they could see in cluster. And the thing which you should not do is break the eruptions on your own or keep on touching them, because breaking the eruption first of all leads to scarring, can cause secondary infection, okay, secondary bacterial infection over it, and it also keeps on spreading the infection, and you can see one boil leads to another. So don't try to touch the eruption too much, do not try to break it. Now talking about homeopathic treatment. Usually, as I said, it is a harmless infection. It can resolve in its own in over a period of 6 to 18 months. But obviously, cosmetically, it doesn't look good when it is on your exposed parts, on your face. So people, patients usually want it to, get better faster. So talking about homeopathic treatment, it has a very good treatment in Molluscum Contagiosum. I have seen so many dermatologists also referring to homeopathic doctors for the treatment of molluscum. So usually with the treatment of 3 to 4 months, okay, the molluscum eruptions completely resolve with homeopathy, and the skin becomes back to normal as it was. So if you have any questions related to the topic, do write down in the comment section. If you're new to my channel, subscribe to my channel, hit the bell icon, and stay tuned for my upcoming videos. Thank you.